Okay, so tell me about your shoulder. Tell me what's going on.
I'm having a lot of soreness and pain when I move it or when I lift things. So it feels like there's either a knot or I was lifting something too heavy or moved it the wrong way, and it's uncomfortable.
Okay, and when did this specifically happen? How long ago?
Going on a little over a week ago.
A week ago. Okay. Do you remember exactly what you were doing when you started to feel the pain?
I think it was when I was holding luggage and taking it to a hotel.
Gotcha. Any specific position the shoulder was in, or you're like carrying it on the back end, or were you lifting it?
I don't remember. I know I was holding a duffel bag, and then that was one trip, and then the second trip I was carrying a backpack, another thing over my shoulder, and then pulling a suitcase with a little bag on top, but it wasn't heavy. But I was pulling a suitcase and I was using both arms because one arm would get tired.
Gotcha. And then can you point to exactly where you feel it?
Here.
Right at the top.
Yeah.
Okay. Is it tender when I touch it?
No.
Okay. Okay. Let's go through some movements, see what's going on. I'm just gonna reach overhead. Any pain with that?
Yeah.
Okay. Hold it there. I'm gonna get a little overpressure. Tell me if it makes it worse.
Yes.
Yeah, it does. Okay. Same thing on this side. Shouldn't have anything. Anything
No,
there?
that's fine.
No. Okay. Go and relax. Bring your arms out to the side. Same thing.
No.
Nothing, huh?
Not as bad.
Not as bad. Okay. Just a little bit of a push. Come back here. Push. Anything if I push up?
A little bit.
A little bit, but way more going backwards, huh?
Yeah.
Okay. Anything here? Anything on this side?
No.
Okay. Go and relax. Okay, next shrug for me. Anything you shrug?
It's uncomfortable.
Uncomfortable? Okay. Next side to side.
No, it's fine.
So, okay. Chin to chest and look up. Okay, look up towards the ceiling all the way. Anything there?
No, it's fine.
Okay, go and rotate left and right. Anything there?
Mm-mm.
So no pain with that.
No.
Okay. That's good news. Anything at all?
Just pressure.
Just pressure. Do you think I come a little lower?
No.
So I think when it does for like the upper trapezius here. Maybe if I dig in, kind of find a little knot. Okay, so when I go deeper, it's there.
Yeah.
Let's check your strength in the shoulder. I'll bring your arm out to the side for me. And relax it a little bit. You feel it?
Yeah.
Okay, hold that there. Ready? 3, 2, 1, push up. Hurts, huh?
Yeah.
Okay, take a breather. Okay, arm straight forward. Hold that.
Oh, that hurts more.
That hurts more. Okay, going forward. Okay, bring your arm straight back.
I don't feel it.
You can feel it there too. Okay, hold it. Then make it worse.
Actually, no. It's weird.
Doesn't make it worse. Just the normal initial motion.
Yeah.
Okay. Okay. Alrighty. So definitely feels like a trigger point here in the upper trapezius.
What's up with me and trigger points?
And trigger points definitely when you overuse that muscle too much, especially that muscle. That one's the strongest in the whole area. So it tends to take over all emotions as a prime mover.
I'm not even a left-handed person either.
Okay, so I'm going to put this towel around to protect your glutes. I'm going to tuck it in. It should keep the shoulder in a certain place. Okay. Perfect. How's that feel?
Fine.
Alright, I'm going to get some lotion on you. This cupping should help with this trigger point. Get rid of it, loosen it up. Make sure it works. Okay, here we go. I'm gonna get some smaller ones. Whole muscle because definitely needs to be released. some gliding afterwards. Okay, so what I want you to do, I want you to bring your nose to your right armpit like you're gonna sniff your armpit. Do you feel any pulling in that region? In that spot? Okay, so I want you to come back to neutral and then back in. Give me 15 of those. And then come down a little bit, kind of down and in to that region. Good, stretches it a little bit more. Okay, good. So next, go and bring your arms straight up to kind of 90 degrees straight forward. Good, up and then down. Do you feel that more? Yeah, there it is. I'm gonna give you an easy one first, easy and.
Okay.
Good. Okay, now same thing out to the side with your thumbs up. Good, just up and down. You feel that there too?
Yep.
You feel less painful than the one going forward?
No.
No, it feels the same. Okay. Yeah, usually when it's on, it doesn't feel too great, but afterwards it feels really good.
Okay.
We'll take a breather. We're gonna pop these off. I'm gonna keep one of them on though. Do some gliding. So for all the listeners for. Okay, it won't feel the greatest, but it works really well to get all the fast roll restrictions out.
Oh man.
Ooh, that doesn't feel great, but does wonders. Okay, probably the most is right here in that region. This doesn't look too bad. Okay, let me wipe this off, yeah. Alright, go ahead and move your arms straight forward.
In front?
Yep, in front and raise it up. How's it feel?
A little better.
A little better. Not as tight and painful?
Still a little sore.
Okay, soreness is
But it's sore here.
like in the front?
Yeah.
Okay, so not the typical back here? Okay, alright, so shake it. So you're talking about right in this little divot or a little further back?
Let me pinpoint it. Sort of, but it's behind it. Behind the collarbone.
Okay, right here.
Mm-hmm.
Okay, looks like once we release this,
Yeah, like
other
here.
muscles tend to come around.
Yeah.
Okay, these guys, the scalenes. That one.
Yeah.
Okay, so
Just a little bit, it's not too bad.
okay, if I pin it and you raise your arm up, how do you feel there?
It's better.
Better. Okay, so we know definitely the scalene is the one at fault. So it does feel like the middle scalene. Yeah, painful. I do feel it. It's very taut. Anything compared to the right side?
That one's fine.
That's fine. I do feel that one there, but it's nowhere near as taut as the left side. Okay, so no cupping for this one, just because it's in a delicate area. So here's what I want to do. We're going to see if we can reduce it. So I'm going to pin it down. What I want you to do is just look all the way to the right and then come back to neutral. Good, 1 second. No, sorry yet. Okay, I'm going to pin and then you rotate back to center. Give me 10 times. Good, feeling quite a bit of a stretch?
Yeah.
Okay, good.
Okay.
Good, okay. Go and raise your arm up again.
It's better.
Better, doesn't feel as bad? Okay, bring your arm out to the side. Let's see if there's anything there. Good, and try to bring it all the way high as you can get it. Good, anything?
No.
Okay, and then one more time going forward, high as you can get it. Good, and nothing, right?
No.
Sweet, okay, so we loosened it up quite a bit. Now on to loading it so we can train the range that we just gained. Okay, so the movement I want you to do, it's called scapular depression. We're just gonna bring the shoulders down and back. The goal is to inhibit and kind of turn off the upper trapezius where your muscle is a little bit irritated. So go ahead and do that motion for me. I'm gonna help you, down and back, hold that there. Squeeze, 1, 2, and 3, go and relax. Good, did you feel it engage here? The muscles got tighter there?
Yes.
Did you feel anything here?
No.
Okay, perfect. Okay, give me 2 more of those just to get the movement pattern down. Good, hold. Good, and then relax. Good, and then do it without me. Good, awesome. I didn't feel anything here, did you?
No.
Good, okay, 1 more for good measure. Good, nice and mushy like I wanted. Okay, we're gonna do the same movement. So go and grab onto that band. So I just want same shoulders going down and back, but I want your arms coming straight back to your pockets. Don't go past the hip. Good. We started struggling a little bit. Relax. Same thing as we talked about. As you bring the arms back, bring the shoulder blades down and back. Think of like you're puffing your chest out a little bit. Down and back. Good. Nice. Much better. Good. How are you feeling with this one, with the resistance?
Fine.
Fine. Doesn't feel anything here still?
No.
Perfect. Good. Go give me about 7 more, because you're just about 3. And then we do another set of 10. So 2 sets of 10 total. So with this band, what I want you to do, we're going to be tensioning it, pulling it out, raising it overhead, coming down, squeezing those shoulder blades on the backside. Get the band to touch the back, and from there come out, and then come back in, touch the front. So front to back, and you're under tension the whole time. So a great one for the shoulder blades and going through the full range of motion of the upper trap that we had some discomfort with. Pull it back, perfect, and then coming all the way forward. Good. How'd that feel on the upper trap?
Feels okay.
Feels okay. Any stretch, any strain?
It's a stretch for sure.
Okay. Alright, aim for about 2 sets of 10 to really get that muscle moving. Once you hit the first set of 10, just take a break about 20-30 seconds. Give that shoulder a little breather. It's not a super hard exercise. Okay, so we're going to do a neck exercise to load the upper traps. So we did the shoulders already, now we're on to the neck, because they all are involved. So we're going to put the band around her head, preferably right above the ears. We're going to pin the band together on both hands and push against the wall. From here, I want you to look directly forward. I want you to do a chin tuck pulling straight back. Then I want you to look to the left as far as you can. Once you get there, pause for a second. Slowly come back. And then repeat going the other direction. Slowly come back. Left and right is 1. We're just aiming for 10 to get started. Okay, bring your chin down a little bit. Not too much. Just need to come down a little bit. Okay, right there. Good. Chin down a little bit and then push straight back. Okay, from here, look left as far as you can. And then right as far as you can. Good. You feel that neck muscles working?
Yes.
Good. Just aim for 10. Left and right is 1. Okay, so tell me how everything's feeling after everything we did today.
A lot better. It's definitely a difference in my pain I was feeling when I came in.
Sweet. Go ahead, move around that shoulder. Tell me if you feel any pain or anything like that going on with movement.
No.
No? Typical motions don't bother you anymore?
Not anymore.
Perfect. Are we sore at all?
A little bit, but I feel like that's normal, right?
Yeah, definitely normal. I know we did cupping with those little suction cups on your back. With that, it may be a little sensitive afterwards, maybe for a couple days. Those sort of should stay on you maybe a few days, sometimes at the latest, like 2 weeks I've seen. All pretty normal. Okay, so with the cupping that we did, little suction cups, the redness and whatnot, that's going to stick around for a few days. At the latest, 2 weeks is kind of a lot, but you didn't have too much tissue damage there, which is completely normal after cupping. What we do recommend after doing cupping is to avoid taking NSAIDs or anti-inflammatory medications to help reduce inflammation. We don't want that. Same thing goes for no ice, and then sometimes heat as well. Just avoid any other external thing on that region, because we want a lot of the healing process to go on, which is what cupping kind of does to the tissues. Continue to move around the shoulder throughout the day, and then with the exercise we talked about earlier, go ahead and do those. I'll send you a workup about it, email with all the videos that we did, and then we'll see how you feel in the next week.
Great. Thanks, doctor.
You're welcome.